I'm Melissa Mancini with Canadian HR Reporter TV. I recently sat down with MacDonald from Manulife Financial to talk about how companies can improve the productivity of their workforce through health and wellness. How can employers determine the health of their workforce?
Certainly the first place to start when working with employers is really understanding their aggregate data that they have already from their group health benefit spend. And then in looking at how do I integrate that and putting together your picture as an employer, looking at by disease state. So, you know, what's my health spend looking like for cardiac-related conditions? What's my health spend looking at like for mental illness-related conditions? And so it's really the number one place is really understanding what your current data is looking like. I think the second part to being able to achieve better outcomes is really putting in a wellness strategy or a wellness program that's really specific to your employee population. And I think one of the things when working with employers that I've found is that they need to really understand the health risk factors that are impacting their employee population.
How should companies determine where they're spending their wellness money?
I'm used to seeing, you know, a number of employers just throwing the various different wellness initiatives, what I call throwing the spaghetti against the wall and hoping that some of those initiatives will stick. They never measured it before, and so they don't know if it stuck, what really worked for their employees. So the second part to it is really, okay, what will work? What's my benchmark, my starting place, and what are the employees, you know, really interested in, and targeting efforts for them.
What are some of the current trends around chronic health conditions?
So some of the common trends we're starting to see of these days, and actually it's been growing. Number one would be 70% of chronic illness or illnesses these days are actually related to lifestyle behavior. For employers, that just means more and more costs are going out related to chronic illness that are lifestyle behaviors. And that when it's lifestyle behaviors, that's actually something that can be prevented or certainly reduced.